Hello, I'm Senator Herb Kohl from Wisconsin, Chairman of the Special Committee on Aging. I'm glad to be here today to answer some important questions on health care from the readers of Time Goes By. The first question comes from Mary in Buffalo, New York, who asks, why hasn't the ban against buying prescription drugs from other countries been lifted? Now, that's an excellent question, Mary. I have long been concerned about the high costs of prescription drugs, which can make it hard for seniors to afford the medications they need. Today, Americans pay substantially higher prices for the same medicines that are far less expensive in many other industrialized countries. Many Americans have resorted to buying their prescription drugs from Canadian pharmacies. Even though they are rarely prosecuted, it is illegal. So therefore, Senate Majority Leader Reid recently announced that he will bring the Pharmaceutical Market Access and Drug Safety Act to the floor by the end of the year. This bill would allow American consumers, pharmacies, and drug wholesalers to legally import FDA-approved prescription drugs at substantially lower prices. It is estimated that this bill, of which I am a co-sponsor, would result in $50 billion in direct savings over the next decade to consumers. However, I will say that I do not believe that drug reimportation is a cure-all for solving the problem of our skyrocketing drug prices. There are many other ways we need to make it easier for seniors to get a hold of affordable drugs, including the government negotiation of drug prices, getting comparative effectiveness studies into the hands of doctors and patients, and making it easier for generic drugs to come on the market, and we should be seriously considering the benefits of all of these possibilities. The next question comes from Patty in Fort Worth, Texas, and she asks, will the final health care reform bill end exclusions for pre-existing conditions? I thank you for your question, Patty. It's impossible to say precisely what the final bill will include at this point, because there are so many more hurdles to jump through before we send one to the President for his signature. But I will tell you what many of my colleagues and I believe, which is that despite our rigorous debate on a few issues, there are many things we agree on concerning healthcare reform. For starters, we all agree that something has got to change. American healthcare is breaking the bank and making us less competitive in the world's economy. Money that should be going to wage increases is instead going to pay for healthcare coverage. This will not change until we get a handle on healthcare costs for businesses small and large, for the federal government, and most importantly, for you and your family. And that is why we all agree that we need to expand coverage to the 47 million uninsured Americans. We want to limit out-of-pocket expenses and copays. We want to make sure coverage is not dropped just when you get sick and need it the most. We want to eliminate caps on coverage and offer free preventive care. And we want to make sure that Americans are not denied insurance because of pre-existing conditions. The principles we agree on far outnumber those in which we disagree. So, I'm very optimistic that when we complete a healthcare reform package, it will end exclusions for those with pre-existing conditions. Thanks again, the Time Goes By, for allowing me to speak to you today. I wish I had time to answer more of your questions, but I am hoping we can continue this conversation in the future. Please remember, you can always visit the Aging Committee website at www.aging.senate.gov to get the latest news on what we're up to. Thank you so much.